Okay, hi there. My name's Gail. I'm a nurse. I'm currently working for the Foreign and Commonwealth Office, where we're dealing with the COVID response and rolling out a lot of vaccines. As part of my job, I have to deal frequently with Public Health England and many other scientists. And I'm just going to run through a real concern, of course, that has come up in recent days about the reported side effect of blood clots following the AstraZeneca COVID vaccine. The AstraZeneca COVID vaccine we think is pretty safe. What we have to just remember is that in the UK we expect to see 2,000 to 3,000 blood clots every month. So it's not an uncommon condition, and we have actually seen less of that since we've started vaccinating. So for the COVID vaccinations in the UK, the AstraZeneca vaccine, we have had 30 reports in total of blood clots that may or may not be associated with the vaccine. And with the Pfizer vaccine, we've had 38 reports of blood clots. It is very difficult when they are so infrequent to be able to say whether they have any relation to the vaccine at all. And the manufacturers of the AstraZeneca vaccine, who we spoke to, cannot think of any scientific reason why the vaccine would be more likely to make you have a blood clot. As always, we are following this up very carefully, though. It's extremely rare. We've had given out over 11 million doses, probably more like 12 million doses of AstraZeneca now, and about the same of the Pfizer vaccine. So to have 30 reports of clots and 38 for the other out of 11, 12 million shots is incredibly rare. So the risk is very, very low. But we will, of course, be following it. And if we do see something that looks like there might be a trend, it might be more likely that it's to do with other medications that people are on. And as soon as we get any indication that this might be a trend, we will immediately change the advice and make sure people get the vaccine that's safest for them. But as we normally get so many blood clots anyway, it is always going to be likely that, unfortunately, for a few people, they will have their vaccine and just have a blood clot that they would have had anyway, regardless of whether they had the vaccine or not. And that's, I'm afraid, just the way things go. So I think the key thing that people need to remember is that the vaccines are safe. We're not sure that the clots are anything to do with the vaccines whatsoever. And if there is a risk, it's incredibly small. Your risks from COVID are far, far higher. So you just need to think that if you get COVID, the illness, you're far more likely to get a clot, and a clot that will kill you, than you will from your vaccine. One of the problems with the COVID infection, so if you get the disease, is that it causes clotting, and that's one of the big reasons why so many people have been dying. And if you go to any mortuary in any of the hospitals and talk to any of the doctors doing the autopsies, you will find that clots are incredibly common in, sadly, the people who have lost their lives to COVID. So if you compare that to the risk of getting a clot from a vaccine, it's absolutely tiny in the vaccine compared to the risk from getting COVID, the disease. So we really need to try and prevent serious COVID, because we know, as like all infections, your risk of getting clots is far higher when you have a serious infection. So just try and reassure yourself the risks are much, much lower with the vaccine than they are with the disease. So the key thing is, as always, to have your vaccines. It's the best way we have at the moment of getting ourselves out of the continual cycle of lockdowns. So when you're called, do feel confident to go and have your vaccine. If you are nervous, and it would be understandable that people are, just remember that the side effects are rare. But as always, if you get any aches or pains that aren't settling in the day or two after the vaccine, or if they're getting worse rather than getting better a couple of days after the vaccine, you should always just see your doctor to double check that everything's fine. But so far we've had absolutely no indication that there is really a real problem, and that this unfortunately looks like it's a really unfortunate coincidence. So please get your vaccines.